The Dr. Fazil TV show is brought to you by POYA, People of Yuma Health Association. The Dr. Fazil TV show is intended for health educational purposes only and complies with all the HIPAA regulations.
Good afternoon and welcome to the Dr. Fazil Show. This is our July 2020 edition. This afternoon we're going to be having a discussion about kidney stones. Thank you, Dr. Fazil.
Thank you, Wendy, for having me in this show today. So I think kidney stone is a good topic, and I think we need to talk about that because a lot of time people think kidney stone is a surgical thing and not a medical thing. And most people who have kidney stone, they go to a urologist, which is the surgical side of the kidneys. We call it a urologist, and they go to them for removal of the stone. So they wait for the stone to happen and then get it fixed, not to prevent it. So prevention is the key.
Can you tell us what is a kidney stone?
So the urine have different chemicals inside, and generally the way the mechanism is designed, the genitourinary mechanism is designed, is that the urine stays in the liquid form. It does not crystallize, it does not make any stones. But in certain conditions, the urine start to crystallize and you start to make stones. So you make a little focus or nidus, and then stones start to grow on top of that. And that precipitation of crystals by any means, by diet or by dehydration, or maybe lack of certain chemicals in the urine, can cause precipitation and the stone formation.
Thank you. And what can we do to prevent kidney stones?
So again, it depends on, if you have to pick up a universal precaution, then drink fluids, water. But as I said in my previous episode, that is a double-edged sword, because if you have other medical conditions like heart condition, or lung condition, or liver condition, or kidney condition, like have a low kidney function, if you try to drink too much water to prevent stones, you might have fluid overload, and your legs start to swell up, and you become into respiratory failure, or you go into respiratory failure. So we have to balance it out. But for argument's sake, let's say if you have a normal, everything's normal, and we're just talking about kidney stones, then minimum is 1.5 liters in a normal environment. If you are in a dry environment, you're sweating a lot, you got to drink more. So the more water you drink, the less chances you're going to make stones, because what happens is your urine is diluted. If your urine is diluted, then you wouldn't make those crystals. And if you don't make those crystals, then you will not make stones. That's like a general precaution.
Okay.
But again, there are different kind of stones.
What are the different kinds of stones?
Wendy, there are different kind of stones. For example, there are stones like calcium oxalate, calcium citrate, uric acid stones. Sometimes we call it staghorn stones. Staghorn stones are generally from urinary tract infection. If you have repeated UTIs affecting the kidney, it can cause staghorn stones. And but those are the common one. And there are some rare ones too, but those are like 99% of the time, these are the stones you get. Calcium oxalate is the most common kind. And yeah.
And are kidney stones painful?
Kidney stones are painful only when they pass. When they pass through the ureters, which are the tubes which connect the kidneys to the bladder. And the only time the stone can pass when it is 5 millimeter or less than that. If it's bigger than 5 millimeter, it wouldn't pass. If it wouldn't pass, then it would not cause any pain, because there's no movement of the stone. So when stones are passing, they have to be less than 5 millimeter, and then when they pass, they cause pain.
What if a stone is too large to pass, larger than 5 millimeters?
If it's too big to pass, then it can cause a blockage to the urine flow altogether, and the kidney can swell up, and it will then in that way it will still cause pain. But that pain will be different than the ureteric pain, which is more of a colicky pain. So you will have pain, but it's like a dull mid-back pain, and it can shut down the kidney too. So that's more dangerous actually, because it's causing pain, not that bad pain, but it can destroy the kidney. We call it hydronephrosis.
So how do you get rid of that stone?
Again, so when you have a stone of that size already, then obviously you have to do an intervention surgically because you don't have time to change the diet to make it small. Although you can prevent the stone by dietary behavior and drinking more fluid, but if your stone is so big that you already have a blockage, then you need to see a urologist, and they have to do either a treatment of a stone by breaking it through sound waves known as lithotripsy, or they have to put a stent in the ureter, or they have to take it surgically. They have to cut kidney open and remove the stone. So it depends on expertise of the urologist, the facility where you're at, the location of the stone, and also how big is the stone is, what technique they're going to use. But either way, that need to be taken out.
Thank you. Dr. Fazil, there are certain people who continuously make the kidney stones, stone makers as we've heard them be called before. How can they learn to break that cycle and prevent the stones from forming?
Wendy, that's a very good question. So the thing is that traditionally, I think it's a lack of or misinformation that I will go to the doctor only when I have symptoms, and they wait for the stone to happen, and then they go to urologists, and then the urologists never tell them that, hey, remove the stone. They said just remove the stone, and I'm sure there's a variation, but it's like you go to the barber and say, hey, do I need a haircut? And they say, yeah, you need a haircut. It's nature of the beast, right? So, and what I'm trying to say is that, you don't want to wait for the stone to happen, then go to urologist, and they're going to say, okay, yeah, I'm going to do a surgery, because that's what they do. And I'm not saying in a bad way, but that's what the reality is. As a physician myself or a nephrologist, my job is to prevent it, and because you can prevent it way early and not go through that painful process of having kidney stone pain or damage to the kidney from the stones. So the prevention would be based on the type of stone you have. So for that, what we do is we do some tests. We do a collection of 24-hour collection of urine, and then we analyze it and see what's the chemistry of the urine is. Sometimes certain elements are more, sometimes certain elements are less. For example, citrate. So citrate is a dissolver. It dissolves the kidney stones. Some people are born genetically with the tendency to produce less citrate. Once we find out if they have less citrate, then we give them potassium citrate tablet as a prescription. They take it lifelong. It will cause the citrate level to be high in the urine, and then they will never have that kind of stone again. So again, that is a preventable disease, but again, you have to know what you're dealing with and not do it just randomly. So if we do that, and sometimes you can have some hormonal disorder, for example, hyperparathyroidism, in which your PTH hormone in the blood is too high. It causes bone to leach out calcium in the blood and cause stones. And I've seen multiple of those patients which were missed all along, and they had a very high PTH level and tumors in the neck, causing those hormones to be released, causing calcium to be high in the blood, and that calcium gets stuck in the kidneys, causing kidney stones. And you can keep removing those stones, but you will never stop the cycle unless you fix that tumor, and then once you know the source of the calcium was that parathyroid hormone tumor, then you fix the problem.
Dr. Fazil, what are the other dietary precautions that we can do to prevent kidney stones?
Yeah, so the other precaution would be, we have found in a lot of studies that preventing animal proteins or eating animal proteins, high salt food prevention, don't take high salt food, or so basically drinking a lot of fluid, low salt diet, and avoiding animal proteins help prevent kidney stones. That's like general formula, but then each person is different, so we still have to do the blood chemistry analysis and the urine analysis, and then see what is really the underlying medical issues which is making stones, especially if they have recurrent stones. If they have stone done in very early in their life, or recurrent stones, then we have to find the source, or it's going to keep coming back and causing pain and damage to the kidney.
And Dr. Fazil, although kidney stones do cause pain and discomfort, what other damage do kidney stones do?
So I think this is an important point here. A lot of patients think that stones are just painful and they will deal with it when it comes. It's wrong, it's misleading. The stones can cause damage in various ways to the kidney. For example, if you have stones in the, for example, if you have stone in the meat of the kidney, you can actually destroy the meat of the kidney, and you can lose the kidney function, and you can actually go on dialysis. And I have seen patients on dialysis because of the kidney stones. The other thing is that it can cause blockage to the flow of the urine, and that can cause back pressure on the kidney, and that can cause total destruction of the kidney. So stones are not just painful or innocent or radiological findings, but stones are dangerous. They can actually put you on dialysis. So I highly advise my viewers that if you do have kidney stones, you should see a kidney specialist and not wait for a urologist to do the surgery on you when it's come to you, because it's preventable. And in my practice, once we find the root cause and we fix it, they never had stone again. So please talk to your primary care physician or to your kidney specialist if you do have kidney stones, that find out the source. And sometime I can tell you it could be due to diet. I have one patient who was from European descent, and he had stones as a child, and he said every few years he have to go and get the stone taken out of his kidneys. And I asked him a few questions, and I asked him, okay, first we did a 24-hour urine test and found his oxalate in the urine was very high. And then I gave him a list of the food, and I said, what are you eating out of this list, which is very high in oxalate? Because your oxalate in the urine is very high. And the number one he picked, and this guy was in his 60s, the number one food he picked was chocolate. He said, I eat chocolate all day long. And we know chocolates are very high in oxalate. So actually he was making stones from the addiction of chocolate. So the chocolates are not all as benign as we think they are.
Thank you.
You're welcome.
This concludes our episode of the Dr. Fazil Show for our July 2020 edition. Thank you, Dr. Fazil, for your time and your knowledge.
Thank you, Wendy, for having me on this show today and discussion about kidney stones today with our audience. Protect your kidneys. Summer is coming. Drink a lot of fluid and stay safe, and take care of your kidneys and take care of your health. God bless us all, and God bless America.